I'm Caterina Fede. I work in the University of Padua in the Department of Neurosciences, and as already announced, I will speak about the fascial tissue and the connections between the hyaluronan amount and the hyaluronan physicochemical properties with the fascial health. So the hyaluronan is the most present polysaccharide of the extracellular matrix, also in the connective tissues. We can find the hyaluronan in a lot of parts of our body, like in the eyes, in the skin, in the synovia, but also in the fascia. It is a glycosaminoglycan. It permits, it is a space filler, it confers viscoelasticity, and it is a lubricant for the tissue. It permits the migrations of the cells, so it is important also for the cancer and also for the metastasis of the cancer. And it confers gliding properties to a tissue. It is involved in a lot of pathways in our body, like inflammation, apoptosis, angiogenesis, and also pathologies like cancer and diabetes. And in the fascia is the key element which permits to regulate the fascial gliding, so the gliding between the different layers of fascia and of the fascia with respect to the muscle. What is fascia? Fascia is a connective tissue which surrounds joints, muscles, nerves, bones. There are different types of fascia. The visceral one that covers the internal organs, and in this picture you can see the superficial fascia, that is the layer immediately under the skin and the superficial adipose tissue, and the deep fascia which cover the muscle. And according to different stainings and different subjects, we can highlight much better or worse the different layers. In this picture we can see the skin, the superficial adipose tissue with all the fat lobules separated by this connective tissue, and the superficial fascia. Here in this picture is most visible the muscle and the connective tissue which surround the muscles. In particular, the deep fascia is organized in sublayers. It is organized in three layers of deep connective tissue, separated by thin layers of loose connective tissue. So as you can see, the dense connective tissue and the loose are different also from a macroscopical point of view. So the dense connective tissue is organized in, is formed by collagen fibers, and the loose connective one is formed of hyaluronan, glycosaminoglycans, proteoglycans, and water. And this thin layer of loose connective tissue permits the gliding of the other layers each other. So in the fascia there are different kinds of cells. The fibroblasts that synthesize the collagen fibers. There are myofibroblasts, telocytes, nerve fibers, but we found also these rounded cells in small clusters, and these cells are at the borders between the different layers, and we named these cells fasciacytes. They are fibroblast-like cells. They are more rounded with a big nucleus, and the extracellular matrix around the fasciacytes is made not of collagen fibers but of hyaluronan and loose connective tissue, hyaluronan glycosaminoglycans. So it is important that these fasciacytes are at the borders of the different layers because they synthesize the hyaluronan. The hyaluronan is in the loose connective tissue and permits, as you can see in that video, the gliding of the three layers of the deep fascia and the gliding of the fascia with respect to the underlying muscle. But how much hyaluronan there is in the fascia? We collected different type of human fascia, for example, from the hip, from the abdomen, and we found that every time, more or less, the mean amount of hyaluronan was the same, 35 micrograms per gram of tissue. It is not so much, it's less with respect to the skin, but this quantity remains constant, and it permits, is the sufficient quantity to permit the gliding of the fascia. In fact, when we move on the epimysial fascia, that is a different kind of fascia, more close to the muscles, it permits the coordination of the different motor units. This fascia has less hyaluronan, only 6 micrograms per gram of tissue, because that fascia has less gliding properties. And when we move on the joints, on the retinacula, we found much more hyaluronan, up to 90 micrograms per gram of tissue. In fact, there is much more range of motion. We can think about the hyaluronan like a sponge that is able to link the water. But if that sponge becomes more rigid, because there is less water, there are more cross-links and binding proteins, the dynamics of the fluid totally change, and the tissue becomes more rigid, and it is not able to glide in a correct way. One of the first papers which demonstrates that dysfunction on the loose connective tissue can be related to pain is this one published by Langevin, the group of Langevin, more than 10 years ago. She demonstrated that comparing a healthy patient with patients, both males and females, with chronic low back pain, she demonstrated that the patients with chronic low back pain has a loss of 20% of shear strain with respect to the healthy one. So it means that that thin layer of loose connective tissue is very important. If it becomes rigid, it not permits the gliding, and it can influence some pathological situation and pain, as illustrated in this graph. So when the tissue is normal, the fasciacytes synthesize the hyaluronan. Here in this layer of loose connective tissue, there is hyaluronan attached to the water, and this layer can glide each other. But when there is a dysfunction and a densification here, we can have more aggregated, auto-aggregated hyaluronan. There are much more cross-links, binding of proteins, and this layer cannot move independently. And so there is much more rigidity, stiffness, and maybe also pain. But which are the factors that can influence changes in the extracellular matrix? Now we are talking only about the changes in the loose connective tissue, but obviously also the collagen fibers can change. But first of all, as we have just seen, the anatomic sites and the type of fascial tissue can influence the amount of the hyaluronan. So when a fascia has much more gliding properties, there is much more hyaluronan there. But also other physiological and pathological factors can change the extracellular matrix. So some chemical factors like temperature, maybe also the pH, the aging also, because we demonstrated that with aging, the connective tissue around the muscles becomes much more and much more rigid. There is much more collagen 1, for example. But also other stimulation to which the fascia can be subjected, like sex hormones, like drugs, chemical stimulation, or mechanical stimulation. And now I will show you only some examples. We can start from the endocannabinoids that are endogenous neurotransmitters that bind to cannabinoid receptors, CB1 and CB2. CB1 and CB2 receptors are expressed in a lot of parts of our body, in the brain, where they can control the nociception, the neurogenesis. They are neuroprotectors. They are expressed also in the cardiovascular system. They are also immunomodulator. They control the mobility of the gastrointestinal tract. In the liver, they control the steatosis, the fibrogenesis. They are expressed also in the bones and in the connective tissue. In general, we can affirm that they are anti-inflammatory, anti-fibrotic, and so also pain modulator. And we demonstrated that they are both, CB1 and CB2, expressed also in the deep fascia, in the human fascial tissues. And so we decided to stimulate in vitro the fascial fibroblasts with an agonist of the cannabinoid receptor CB2. And we noted that immediately after treatment, the treated cells start to produce some vesicles. The cells change their morphology, and they produce a lot of vesicles released into the extracellular environment. The control cells have no production of vesicles, whereas the treated cells have a lot of vesicles inside the cell cytoplasm. We also use the transmission electron microscopy to highlight the production of these vesicles. This is an elongation of the cell with these vesicles very rich inside of loose connective tissue, and in particular hyaluronan. In fact, the vesicles are positive for the staining for the hyaluronan binding protein. So it means that the treated fascial cells can produce much more hyaluronan, and maybe this is very important to help the tissue to have much more fluidity. We don't know the effect on the time, so at least temporarily there is a greater fluidity of the tissue. We also use the mechanical stimulation, in particular the extracorporeal shock waves, to stimulate these fascial fibroblasts in vitro. And again, we noted the formation of some cytoplasmic vesicles immediately after treatment, but they are visible also after 24 hours after treatment. And these vesicles were rich in hyaluronan, this one in light blue, and in collagen 1, in collagen 3. So it means that a mechanical stimulation can stimulate the cells of the fascial tissue to produce new extracellular matrix. And this is important for the remodeling of the tissue. And we have to think about this aspect to understand how this treatment can help to reduce the tissue stiffness and to remodel the extracellular matrix of the tissue. We are also studying the effect of temperature on the hyaluronan viscosity with the help of the Department of Chemical Sciences. And in this graph, we have the viscosity of the hyaluronan in a range of temperature from 37 degrees to 44 degrees. So that is the 37 is the physiological temperature, and when we, for example, we have a manual treatment, yes, in the manual treatment we have an increase of 2-3 degrees of temperature, so we choose this range of temperature up to 44 degrees. So the red line is the 37 degrees viscosity, the purple one is 44 degrees, and so you can see that with a higher temperature we have a decrease of the viscosity, and so again a much more gliding of the tissue. So when we have, for example, a deep massage or a thermal care, there is a breakup of the chains of hyaluronan, a decrease in viscosity, and a greater flexibility of the tissue. The opposite situation when there is a cold tissue or an immobilized tissue, so the hyaluronan becomes no lubricant but sticky hyaluronan with cross-links and binding of proteins. There is an increase in viscosity and so much more rigidity and fascial stiffness. So to conclude, we have to think about the fascia like a tissue that can answer to a lot of stimulations, and it's very important to know all the aspects of the fascial tissue in a healthy subject to understand which are the alterations in a pain conditions. So every stimulation, every factors that we are studying, every time change in vitro the fascial tissue. So drugs, mechanical stimulation, but also pathologies, surgery, maybe also a scar can influence, aging, hormones, and why not also movement, food, and sport. Okay, so I thank you for the attention.